Hello again, everyone. Mark Macomb, Macomb County Executive. John Paul Rea, Deputy Executive. Got a lot of information. Some of the stuff is breaking news, but again, by the time you review this and look at it, maybe not so breaking. Interesting enough, over the weekend, the big conversation was what happened Friday with the Supreme Court. There was a question before them about this 1945 Act and the governor's emergency powers. I think what people really probably are wondering is, okay, what does this mean? Set aside executive orders, the pandemic. I think what the court had to rule was make a determination basically on that act. Can a legislative body or any body give another branch of government their authority endlessly? And that's what the ruling pretty much entailed. And so I know some people are upset about it, not happy, others are applauding it. The reality was, as a branch of government, I cannot take executive branch roles or responsibilities away from the judicial and or the legislative. With that being said, I also cannot give them my responsibility or role. And I think that's what the courts ruled here. And the 1945 Act did just that. The legislative body gave the executive branch a endless ability to kind of bypass their powers and their ability to intervene or get involved in something. So that played out. The courts ruled, that's finalized, that decision. Now what happened was an undoing of a lot of these emergency or executive orders. Then we heard shortly after that the Attorney General said, moving forward, she's not going to be enforcing any of them if there is a question of, a 21-day period here for reconsideration. So now we know there wasn't going to be any enforcement of the current executive orders. And then we had this real concern as to, so what's everybody going to do about it? There was no indication what was going to happen at the state. So you had local municipalities or local governments deciding to take it upon themselves to enact through emergency, declarations of their health departments, adopting those executive orders and saying we're going to do that as a county with question of enforcement. What are you going to be able to do or how are you going to be able to enforce that? Again, leaving out a legislative body. So question came my way, what are we doing here in Macomb County? Simply put, I'm one of those people that is steadfast in the belief that this needs to be something that is at the state level. This can't be kind of piecemeal together at local levels with counties doing different things or local units of government. There needs to be a statewide response to this, and there should have been from day one. So, like the stay-at-home orders or not, like the shutdown of the economy at the beginning or not, it had an impact and it was effective. So the state needs to lead this. Question was, should along the way the governor have been using the legislature to dictate or decide what we're going to be doing, or other health orders from Michigan Department of Health and Human Services to do this? Probably should have been done because now we're in a quandary. But where we're at today, breaking news, Department of Health and Human Services has said we are going to continue the mask mandate as well as some of the others in the executive order. So local units of government do not have to weigh in on this or come up with some kind of a health order from their health department, which is significant because the question is, who's going to enforce it at the local level or the county level? And far be it for us to just say, hey, here's a law, here's an order, knowing that we can't enforce it or aren't going to be able to enforce it. So fortunate that I think we're seeing now once again, it is a directive coming out of Lansing where they're going to continue this mask order. And as we always say, our job is to get people to comply with CDC guidelines. Follow the guidelines. I think that is the most important, and we're hoping people do it voluntarily. We see it happening. Masks, social distancing, washing your hands. We highly suggest, recommend, and encourage people to follow those guidelines. And now it's still, from my understanding, a law as a result of what the governor has done.
Mark, I think quandary is the appropriate word here. Clearly, DHHS this morning through the governor in a briefing with Press Pool highlighted the fact that those elements of the order are still in place and will be administered, mandated, and I guess for lack of a better term is recommended and encouraged too from the Department of Health and Human Services. Our health department obviously is working and communicating with those state agencies to understand the implications that has not only on local businesses but also individuals as they go out in public. Private businesses can continue to put in their own level of comfort with regards to their operations too, and will continue to provide resources there. But as you said, Mark, this will be a conversation that will not only happen in a legal realm, but also out in our community as we continue to engage each other and ensure that we have the most responsive elements in place to aid people, educate people, and advocate for folks through this, and not just be dismissive or dictate things that may add to additional confusion.
Yeah, and right now there's highly polarized positions on this. People thinking, I have a constitutional right to make my own choices. You got got the other side of, you know what, everybody needs to wear it because we need to save lives. And with that, you know, there's a lot of tension, and you know, understandably. But I think we need to allow our elected representatives to weigh in on it. And when I say that, if you think about it, at the local level, we saw that when it came to, you know, the governor allowing local school districts to make a decision as to what to do with our kids. So at the localist level, you had a body, the school boards, legislative, working with administrators to decide what they're going to be doing, and it's all over the map. Everybody is doing various different things all around the state. And then obviously at the local level, whether it's a city, it could be a township and or a village, they have local legislative bodies that will make decisions, and they can. But at the county level, that's a little different. A county board can't really make laws that would impose, I guess, sanctions or criteria on the municipalities that make up the county. And so, yet a health department has the ability through some type of a health order to impose something, but the question is, how does that get enforced? And that really puts things into, as we just kind of mentioned the word of the day, quandary. You know, how do you do that? And one of the things I refuse to do is just do something knee-jerk reaction and knowing that you can't really back it up with enforcement, because really what then that becomes is a suggestion, and those suggestions are already out there with CDC guidelines. There are requirements that people follow, and so we fully adopt that and encourage that. But more importantly, this should be a statewide responsibility to try to figure out, what are we doing? No matter if it's businesses opening, closing down, try to make a determination, mask wearing, not mask wearing. This is something that the legislature at the state level needs to be engaged with. And you know, if not, even the Health and Human Services Department at the state making those guidelines so it's statewide and there's no confusion with that. So again, Friday, now here Monday, everything is still moving in a process. Whether you like it or not, you're still going to have to wear those masks in the various settings, I think, as we've seen before. So, you know, trying to calm people down during this crisis has been probably the biggest challenge, and it's unfortunate because there's a lot of, you know, concerning comments and you know, negativity as a result of that. So,
Mark, we've been dealing with a lot of extremes throughout this entire process, but we've always encouraged and engaged the public, whether it's clarifying something coming down from the state level, providing a resource, or giving some type of support through the multitude of departments that continue to respond to this. It's something we're going to very much not only be committed to do as we move forward, but more importantly, clarify and get individuals the best support that we can throughout this.
And note to that, our health department working, as I mentioned before, with the various school districts doing various things. We're starting to see some are now going to be going more to that in-person learning. Some of the districts here in Macomb County, I think they're picking that up now. Some are extending. Those that had, you know, maybe half-day sessions for some of the kids are now making that you know, more prominent, where kids are going back to school. Our health department's been working with them incredibly close, and you know, they're seeing that there's been a lot of progress made, and you know, it seems to be working out pretty well here in the county, and we're going to continue to guide them and kind of work with them again. But that's a local school board decision as to how they want to do that. Our job is to try to figure out how do we make it as safe as possible, and our health department has been right on top of that.
Mark, we've been not only engaged in the weekly superintendent's call, where we're providing information and resources to those schools, whether it's initially the PPE, also the technological resources, and now the next wave of support as we bring more children into the learning environment. It's been great not only having that back and forth with the districts, getting our emergency management team involved too, and ensuring that we're leveraging those federal resources we got through the CARES Act to impact our local community in so many ways, and ensure that education can continue in a non-disruptive way.
And we've seen, I mean, obviously the flattening of the curve, hospitals are still not inundated. We talk about this, and you know, week after week we've been able to, you know, at least say that on a positive note. You know, knowing that there's still community spread, there's still that warnings that are out there. But even if you look at the totals, when you look at the death totals or whatever, which is a significant indicator, even percent positive tests, again, from March, April, May, all the way on down to where we're seeing now, wow, what a huge difference, I guess if you will, drastic difference in the numbers when it comes to percent positive, from 47% to now 5.2%, from a high point of over 600 deaths to just last month a total of 33. Again, we don't want to see anybody die. We know that there's sometimes the question, is it really on the death certificate death due to COVID or death as a result of, you know, having COVID, you know, in part being tested, you know, even while they were dying as a result. It's a concern still, but even those latest indicators that the governor has out there, or the state I should say, where they're talking about, you know, the percent positives and as well as the concern we're seeing here in Macomb County, very, very small numbers, and I think we're in an A category, if I'm not mistaken, whatever that is. I'm still trying to figure that out.
Yeah, the Michigan Safe Start metric has moved in more to a grading level currently right now, as Mark highlighted, with a positivity rate on tests in the low 5s. We are currently in that A area, and I guess going back to K through 12 and A would be pretty good. This is information we're going to continue to track. We're going to use our epidemiology team. We're going to be using our communicable disease team, making sure that information is updated, detailed, and as transparent and clear as possible on our dashboard. And should there be any organizations, industries, or other institutions that need assistance, we're there to provide that clarification to Mark.
And on a note, just so people understand this, I mean, when it comes to state of emergency, there is no local unit of government, municipality, county, and now the state. No one has a state of emergency in place at this point in time, but still, knowing that doesn't mean that we're not going to continue to figure out how do we engage and how do we encourage people to follow CDC guidelines and work through our health department. So the numbers have gone down drastically. There is without question an engagement on behalf of the hospitals that can continue to deal with this as we progress, and we got a lot of work coming from our health department, but we're fortunate. The numbers are going in a positive direction here in Macomb County, and I think throughout Southeast Michigan, and we're going to continue to work through this crisis, if you will.
Absolutely, Mark. And obviously, as we continue to the COVID response, we have departments and agencies and partners that are continuing to innovate. We've got a great event coming up this Friday, October the 9th, from 9 a.m. to 4 p.m. Macomb St. Clair Michigan Works is hosting a virtual job fair. So again, we go to macombgov.org, or you can Google search Macomb St. Clair Michigan Works. You can get information on a virtual job fair that will have dozens of employers that are highlighting employment opportunities here within our community and connecting to those resources that John Bierbussy, Chris Riley, and the whole team over at Macomb St. Clair Michigan Works have been continuing to modernize and deploy even throughout these volatile economic times.
Because there are still employers out there looking to hire, and there's still work available for people that are interested. Through this challenge or this crisis. Just last week, we had Manufacturing Week. I was out with Gary Peters at Futuramic, where they're making spaceships to launch, into the orbit there, which is pretty remarkable. We always said that that space launch to Mars starts here in Warren, Michigan, Macomb County, which is pretty interesting. Knowing that they're actually making these fuel cells here in a facility in Macomb County. So again, a lot happening with manufacturing. It's still working. We're chugging along. When it comes to the economy, they're making things happen, and there are job opportunities out there. We hope that people connect with those opportunities either by going to Michigan Works and or the Macomb St. Clair Workforce, or go to macombgov.org for more information. So in the meantime, I add to this, keeping you and your family safe, but also if we could just take a moment and just calm down. I mean, not get too overreactive to things that are happening in the news, decisions that are made at the state level, even decisions now that are made by the Supreme Court. It's difficult. There's a lot of challenges, and people for some reason just want to continue to fight rather than unite. It's pretty tense out there, and the animosity is running heavy. So again, we hope people are patient, calm down a little bit, don't get overexcited, but again, on behalf of JP, myself, and the rest of us here in Macomb County, I'm going to continue to remind you to keep you and your family safe.